My name is Jocelyn McGuire. I am a nurse practitioner at Norton Neurology Hussing Family Multiple Sclerosis Center. Thank you for attending the Multiple Sclerosis segment of the 2021 Norton Neuroscience Expo. Today, I will be discussing the importance of addressing other health and wellness concerns beyond the multiple sclerosis diagnosis. I have no disclosures to report. The objectives of this presentation are to discuss how health and wellness impacts multiple sclerosis, review ways to improve health and wellness, and discuss common comorbidities of MS and how they impact living with MS. Multiple sclerosis can impact many aspects of your life and body, such as your balance or walking, vision, cognition and memory, digestion, bowel and bladder functioning, intimacy, and mood. Other aspects of life that may be impacted are relationships with friends and family, career, and hobbies. You likely talk about these issues frequently with your MS provider. There's a lot to think about when it comes to MS. It's easy to forget about other aspects of your health or think that everything you need to address can be done at the MS follow-up visits. Just as there is more to you than your MS diagnosis, there is more to your health than MS. Maintaining a healthy lifestyle and overall health and wellness not only can help you feel better, but can have a profound impact on your MS, which we'll discuss in more detail later. The World Health Organization defines health as a state of complete physical and social well-being and not merely the absence of disease or infirmity. Wellness is multidimensional and can be thought of as a continuum aiming for holistic health. Some of the factors that contribute to wellness include physical, mental, spiritual, emotional, social, and environmental factors. I mentioned living a healthy lifestyle, but what does that really mean? There are many components to this, but some include exercise, making healthy food choices, not smoking, mental, emotional, spiritual health, and addressing other health conditions. This seems overwhelming, but addressing one of these at a time or making small changes can have a significant impact on your overall health. Some measures you can take to improve your physical activity are to walk a little bit each day and gradually add more as you're able. Attend a yoga, tai chi, or aquatics class offered through the Norton Neuroscience Institute Resource Center, or meet with a physical therapist to learn a strengthening or stretching program. I do want to add that you should check with your primary care provider before starting a new exercise program. To improve your diet, you could swap one sugary drink per day with a water or seltzer water. Choose whole wheat or brown bread, rice, or pasta, or eat a sweet potato rather than a regular baked potato. Or meet with the dietitian who is available with the Neuroscience Institute Resource Center to discuss your diet. If you are ready to quit smoking, you can discuss methods for quitting with your primary care provider or MS specialist. To address mental, emotional, or spiritual health, you can do some deep breathing exercises, meet with our clinical psychologist, or talk with your spiritual or religious leader. Another way to address overall health and wellness is to have regular visits with a primary care provider. This does not necessarily mean that you have to see your primary care provider every month, but we do recommend that you have at least a yearly physical. Your primary care provider can ensure that you have completed age-appropriate health screenings for diabetes, hypertension, cancer, and other health conditions. Your primary care provider can also oversee the management of other diseases or health conditions you may have, such as heart disease, diabetes, hypertension, thyroid disorder, or depression and anxiety. Seeing your primary care provider on a regular basis can help in practicing preventative care. Preventative care means addressing health issues before they develop into more serious conditions. I will now discuss how different health conditions or health risk factors can impact multiple sclerosis. Heart disease is one of the most common health conditions in the United States, and individuals with MS are not excluded from this. Studies show that cardiovascular risk has an impact on multiple sclerosis. There are many factors that determine cardiovascular risk, but a few include high blood pressure, high cholesterol, diabetes, and obesity. Higher cardiovascular risk is associated with higher risks of relapse, disability progression, and disease-modifying therapy escalation. There may be an association between cardiovascular risk and cognitive function. Other studies showed that cardiovascular disease risk factors, or hypertension and heart disease, contributed to increased lesion burden and brain atrophy. You are probably aware that obesity contributes to the development or worsening of many diseases, but it also can contribute to worsening MS or MS symptoms, either directly or indirectly. One review found that excessive weight gain contributes to worsening inflammation, muscle mass, fitness, fatigue, and depression. These are all components of worsening MS or worsening MS symptoms and disability. However, it is not clear based on current research if obesity contributes to worsening disability progression. Smoking increases the risk for many health conditions, including lung disease, heart disease, and some cancers. It can also contribute to worsening MS. Smoking can worsen neuroinflammation and demyelination, which are the two main components in the development of MS lesions in the brain and spinal cord. It can also contribute to a higher likelihood of developing secondary progressive MS, shorter time to transitioning to secondary progressive MS, and higher expanded disability status score, or EDSS, and disability progression. Additionally, there are studies showing that disease-modifying therapies do not work as well in smokers compared to non-smokers. There is also evidence that tobacco cessation, as well as physical activity, can help in managing fatigue, which is one of the most common symptoms of MS. As I mentioned earlier, when you are ready to quit smoking, discuss strategies for quitting with your primary care provider or MS specialist. There is also a free smoking cessation course offered through Norton. Individuals with multiple sclerosis should obtain all of the age-appropriate cancer screenings that others who do not have MS receive. Talk with your primary care provider about when you should have screenings for certain cancers, such as breast, colon, cervical, prostate, or lung cancer. With the physical symptoms of MS to contend with, it can be easy to overlook mental health. Studies show that there is an increased prevalence of depression and anxiety in MS. Symptoms of depression can overlap with symptoms of MS, such as fatigue, decreased activity, or cognitive changes. So it can be difficult to differentiate between depression and MS. Treatment of depression and anxiety can include therapy. We have access to social workers and a clinical psychologist here at the MS Center who provide therapy services. Medications can also be used to treat depression and anxiety, and these can be prescribed by your primary care provider, MS specialist, or a psychiatrist. Other methods in the treatment of depression and anxiety include support groups, yoga, tai chi, or meditation. The Resource Center offers these free programs that can help not only with depression and anxiety, but other MS symptoms as well, such as balance and spasticity. The takeaway from this talk is to demonstrate the importance of addressing other health issues besides your MS, as well as to talk with your primary care provider and other providers about your other health conditions. Addressing risk factors and other health conditions not only improves your overall health, but also aids in the management of your multiple sclerosis. In other words, feeling good about your health and wellness can help with your MS. Thank you for listening to this presentation. Multiple sclerosis can be an overwhelming disease to live with. Taking care of your whole self can help you live your best life.